Can you explain what radial access is?
Sure. The radial access is just another way to approach the heart utilizing a different vessel. And traditionally, we've used the femoral arteries to gain access to the heart. The radial artery in the wrist is just another way to be able to gain access. It had not been used as frequently in the past, but is another option to be able to safely access patients.
Explain how the procedure works.
Procedure for the most part is the same as it has been for any other traditional cardiac catheterizations. From the patient's perspective, their hand is put in a special arm board, their arm is cleansed. At the radial artery site at the wrist, they're given local anesthesia, and then access is achieved through a very small micropuncture needle. Then through fluoroscopic guidance, the catheter wire is advanced into the heart, and the procedure otherwise is very similar to a traditional catheterization from the femoral approach. What is slightly different is that there are newer and different techniques as far as equipment availability, which make it easier and safer. And when the procedure is finished, there are some additional techniques which are used to allow patients to have good hemostasis at the site.
What are some of the benefits after the procedure?
The benefits are clear that patients are able to get up out of bed sooner. Typically, with a diagnostic procedure performed from the femoral route, patients are in bed at least 3 to 4 to 5 hours. They have some immobility and cannot move around. With the radial artery technique, patients are able to get up out of bed, off the procedure table. They're able to go back to the room. They can sit up in a chair. If they need to go to the washroom, they can. They can use their other hand to eat with, and those are clear advantages. If you look at patient satisfaction, we've got many patients who had the procedure done both ways, and clearly they are quite satisfied with the ability to utilize a radial artery access.
There are lower complication rates with radial access than traditional procedures.
And even in good, skilled hands, there's a certain percentage of patients who have a successful procedure that can end up with groin bleeding complications. That number consistently is around 4 to 5%. And despite closure devices, despite other techniques, those numbers remain fairly consistent. If you look at the bleeding complication rates with radial artery access, those numbers plummet to pretty close to zero. And so that becomes another major advantage of the procedure.
How common is the procedure here in Siouxland?
Well, cardiac catheterizations are done, quite commonly. And if you look on a national basis, right now about 5% of cardiac catheterization procedures are done radially. My strong suspicions are that within the next 2 or 3 years, that number is going to jump up dramatically, simply because the public is going to demand it, and as more and more physicians become trained and feel competent with it, those numbers will rise. If you look internationally, those numbers are extremely high, probably in the 90% range if you look in Eastern markets, in Asia, and in Europe.
You have a band there. Kind of explain to us a little bit how that works.
Sure. This is just one of many different techniques that are used. This particular band is clear, so it allows you to see when the procedure is done and there's a catheter in place. This is simply affixed over the artery at the puncture site, and then air is instilled in a bladder. And the bladder is inflated right over the arterial puncture site. The line is removed. This remains in place then for the next couple of hours. The volume within the bladder can gradually be decreased, and ultimately then is removed before the patient goes home. And so it's really quite comfortable. You've got motion on your hands and fingers. At the same time, you're providing subocclusive pressure at the arterial site. And that's really an advantage because it prevents any issues of loss of pulses into the fingers and hands.
Is there anyone that this procedure is not maybe appropriate for?
Yeah, just about every patient, it is possible to utilize this technique. If there are patients who have previous problems with the artery in the wrist, if they've had trauma, or if the artery has been used for other surgical procedures, then obviously they're not going to be a candidate to utilize this. But from the access of the radial artery, we've done any of the procedures that we normally do from the femoral artery, including stent placement, including hemodynamic assessments, crossing valves, even doing peripheral vascular evaluations. All of it can be done through the arterial access in the wrist. The only real exception would be if someone would require a very large size catheter system for something like an intra-aortic balloon pump. That could not be done through this access site.
But you feel as time goes on that more and more people will start seeing the benefits of this, become more aware, and ask for it.
Absolutely, and we already have patients now who come in, and physicians who are referring patients to me who specifically would request this. And it's particularly helpful in patients who are older, if they have other orthopedic problems, back problems where they simply can't lie flat for a period of time, patients with other comorbid medical problems, lung problems where they can't lie still, or even those who may be obese who would have great respiratory difficulties if they were required to lie flat for extended periods of time.